Welcome to We Are Austin. I'm Taylor Ellison. Hopefully you had a great weekend and a great end to spring break. We're going to kick things off with Medical Monday this morning, sponsored by Mann Institute. So you can ditch the reading glasses and see clearly now. Mann Institute is well known for their LASIK surgery, but that's not their only specialty. Dr. David Tremblay is here to tell us why, let me get this right, refractive lens exchange might be the right choice for you. David, thanks for being back.
Good morning, Taylor. How are you?
I'm good. I'm excited to learn about this.
Yes, so refractive lens exchange. Really, let's talk about what it is first of all. It's essentially cataract surgery, but it's in a typical patient that's not the usual cataract surgery age. So typically when we're thinking cataract surgery, it's somebody in their 60s and 70s that's developed a cataract or a clouding of their lens that's causing significant vision problems, glare, difficulty reading, blurriness, those types of things. Refractive lens exchange is that same surgery, but in a younger patient, somebody that's starting to develop up-close vision problems in their 40s and 50s, but haven't quite developed that cataract yet.
Good, so there's options for people out there.
Exactly.
So what does the procedure look like specifically?
So like I said, it's the exact same thing as cataract surgery. So typically it takes about 10 minutes per eye. Now with cataract surgery, we usually delay the eyes. So we do one eye, followed by the other eye typically a week later. With refractive lens exchange, we can do it on the same day, which is nice, both eyes. The surgery is about 10 minutes per eye. It's very comfortable. Patients are usually awake during the surgery, but they're given a sedative and some relaxing medicines and painkillers so that it's comfortable. They're maybe talking to us and awake, but they're not in any kind of discomfort.
I'm always so amazed by the time. It's only 10 minutes.
It's extremely fast. Most of the patients actually ask when we're starting, and we've already finished the procedure.
Are you serious?
Yeah.
Wow. So what does the downtime look like that afterwards?
It's extremely quickly to recover from. So typically your vision recovers either the same day or the next day. Every once in a while somebody takes a little bit longer just because of a healing process, maybe up to a week for the vision to come back to where it should be. But you're back to your normal activities the next day typically, other than heavy lifting and putting a lot of strain on the eyes, doing things that are too rigorous.
Yeah, really quick turnaround. You talked about getting your patients relaxed. How do you do that? Because I'm very squirmy when it comes to the eyes, so how do you set the environment so people feel warm and welcome there?
Sure, so the surgery center, first of all, is very comfortable, but when you come in, you actually get an oral sedative, so you take something by mouth. We do IVs occasionally. It depends on the patient and their health. If it's a healthy patient, sometimes we can avoid the IV altogether, so there's no needle sticks. So it's really just an oral medicine.
Cool.
So it's extremely comfortable. And then some eye drops to numb the eye.
Wow, that's great to hear. And so what are some of the benefits and how long do they last?
Right, so let's talk about why we're doing a lens exchange in the first place. So we do LASIK as well, but this is typically for a patient, like I said, in their 40s and 50s. And when we turn 40, there's a natural change that happens in our lens within the eye where it becomes stiff and we're unable essentially to see both at distance and up close. And so people that have either never worn glasses before or that have worn contacts or glasses for distance are suddenly having blurriness up close, and they're not able to see their phone or read at nighttime. And so those patients will come to us for a LASIK evaluation where we could do LASIK, but typically with LASIK, in those cases, we're having to set one eye for distance and one eye for up close. It's something called monovision. The disadvantage of that is that you lose a little bit of your stereo vision, a little bit of depth perception, and sometimes the brain just can't adapt to that. And so refractive lens exchange is a nice option because we're essentially removing that dysfunctional lens and replacing it with a new plastic lens that lets them see both at distance and up close in both eyes together. So we restore that good, clear vision at both ranges.
Yeah, that is a really great option. You were talking about walking through with your patients. So is there a consultation so you guys can decide what the best fit's going to be?
Absolutely. So come in for a free consultation if you're having difficulty with either vision at distance or up close and you're in that age range. You may be a great candidate for the procedure. Now, we have also great technologies that are new. In fact, a new lens that just became FDA approved last year called the Symphony lens, which is giving us excellent distance vision outcomes and great intermediate and near as well. So the technologies are prime and perfect now, and it's a great time to be doing this.
And we've got experts like you guys, which can make everybody feel good and comfortable. So there's the information on the screen. Dr. Tremblay, thanks so much for being here. And again, my own personal experience with Mann is you guys do make people feel so comfortable. It took like 4 doctors for me just to have an eye exam because I couldn't calm down in there. But you guys were all so accommodating. Thank you so much.
Thanks for having me.
We'll see you soon.